Hello guys, how are you all? And yesterday I'm really sorry that there was a power cut and we couldn't expect, so the session was cancelled yesterday. Good evening Najmal, good evening Ricky, good evening Jeshwant, Rishit Verma, good evening Suraj, Devendra Solanki, good evening. You're fine, Devendra? Upcoming. Right, so how are you all guys? Devyanshi Kati, good evening. Right, Riya Singh, good evening Riya. चलो सो हम शुरू करते हैं ना. प्रियांशु, गुड इवनिंग. राइट, so guys, let us start discussing the topic now. So yesterday I think most of the students joined today newly, right? So yesterday there were only 30. Yes, actually upcoming doctor, I have already started with general anatomy only. That video was posted day before yesterday or before that day, I think, so you can watch there. So Aki, once the lectures are completed, then time to time, I mean, topic by topic we can discuss, and after that we'll dive into head and neck, abdomen, and etc. etc. Okay, chalo. So the first important thing I wanted to discuss here is regarding the important bones here, right? So when it comes to osteology, the first important bone which you see, all of you, is your clavicle. Okay, so clavicle, all of you know that this is a clavicle, right? So clavicle is the first important bone which you see. Now, within this clavicle, first important point I want to tell you is that all of you know that clavicle is S-shaped, right? Clavicle is S-shaped, right? I will tell you the basic points which you need to remember in MBBS first year, and I will also tell you those points which will come in your exam. Okay? So, regarding this, yes, Ritik, there is also a part on gametogenesis. Right. So regarding this S-shaped clavicle, if you see here, guys, so here there are two parts, right? So this part, whatever you can see, this is called as the lateral end of the clavicle, okay? And this part which you can see is the medial end of the clavicle. And if you look at the lateral end, how is the lateral end located? The lateral end is flat, right? The lateral end is flat. But if you look at the medial end is in the form of a quadrilateral shape or a square shape, right? Now, lateral end here, it attaches to the acromion process of scapula. For example, if this is a scapula, right? This is a scapula. Now, in the scapula, all of you can see that this is called as an acromion process, okay? So, the lateral end attaches to the acromion process of scapula, whereas this medial end attaches to the sternum. Okay, so can I call this lateral end as acromial end and medial end as sternal end, right? Medial end is called as sternal end and lateral end is called as acromion end, right? So all of you just concentrate here. Now let us discuss these things, right? So all of you look here now. As you can see the clavicle over here, right? As you can see the clavicle over here. So this clavicle is comprised, right, of two ends. So we have got one is called as a medial end, another one is called as a lateral end. Now guys, all of you just I'll give my mobile number also, don't worry. ठीक है, अभी फिलहाल तो क्लास के ऊपर concentrate करो. I'll give all my personal details for you. ठीक है. So here if you see, this is not right and left clavicle, okay? This is only a single clavicle. You are looking it from two views. One is from the top view, one is from the bottom view, okay? So this is the clavicle which you are looking from the superior view, and this is the clavicle which you are looking. This is the superior view and this is the inferior view of the clavicle, okay? And what did I just told you? I told you that this end of the clavicle is called as the medial end. Okay, this end of the clavicle is called as the medial end of the clavicle. Medial end of the clavicle. Medial end is also attached to what? Medial end is attached to sternum. So can I call it as a sternal end? This is also called as a sternal end. Okay. In the same way, if you look at this part over here, this is called as the lateral end, right? Or it is also called as the acromion end. Acromion end of the clavicle, right? So these are some of the important things which you need to know. Now after this, The first important point I want to highlight here is that clavicle is the only bone which is located horizontally in your body, right? So all the way from medial end to the lateral end, clavicle is the only bone which is located horizontally. So this is the bone which is located horizontally. Okay. Second important bone. Second important point. Second important point is that out of all the bones which you have in your body, clavicles are the first bones to ossify. Okay. So when does this ossification takes place? Ossification matlab jante ho na? Ossification matlab formation of a bone. Okay. So formation of clavicle. Clavicle is the first bone to form in the body. You know, when it is formed in the prenatal time itself. I mean, it is formed during 5th, 6th week of intrauterine life. Okay. Intrauterine life. Yes, Anish, I can understand that it was already done in the yesterday's class. But yesterday there were not much students. Okay, today many students got added so that it would be beneficial for them. And moreover, yesterday's videos has also been deleted because sirf 30 minutes video tha na, right? So second important thing, just I told you that this is the first bone to ossify. This is the first bone to ossify. Okay, this is the first bone to ossify. And when it is getting ossification, when is the ossification taking place? During 5th, 6th week of intrauterine life. During 5th, 6th week of intrauterine life. IUL stands for intrauterine life. Very good, Akhil. Very good. So Akhil is telling that this is the most common bone that is fractured in the body. I agree. Okay? But can anyone tell which location, right, the fracture basically happens? Right? At which location of the clavicle the fracture is usually seen? Can anyone? Yes? Exactly at which part the fracture happens to the clavicle? Right. So those of you attended yesterday's class will answer correct, and those of you are attending now, see. Very good, Suraj. Suraj, fun mode. Anish Vyas, very good. So yesterday I have told you, see, medial 2/3, lateral 1/3. So that is a different scenario. Okay, so that is not there now. So it has been outdated. So the new update is that the fracture of the clavicle is exactly at the junction of medial 3/5 and lateral 2/5. Okay, exactly at the junction of medial 3/5 and lateral 2/5. So this is the new update which is given in the grace. So I want you also to be updated regarding this information. Okay, so where is the clavicle fracture taking place? It is happening at the junction. It is happening at the junction of medial 3/5 and lateral 2/5. Okay, medial 3/5 and lateral 2/5. So I hope all of you understood regarding this point, right? So this is one of the very important point which you need to know. And you know, every bone has got a medulla in it. Yes or no? Medullary cavity is there, but this is the only bone in the body which is not having medullary cavity, right? So this is the bone in the body which is not having any medullary cavity. So this is one of the bone which is not having any medullary cavity. No medullary cavity, right? Now what I will do is I'll give an X-ray and you will diagnose and tell me, right, what is a fracture here. Okay? अभी ये X-ray देखो, all of you just look at this X-ray over here. Now, can you see a fracture of the clavicle or fracture of humerus or both? बताओ. Fracture of clavicle only or fracture of humerus only or both of them? कहाँ both? See? When I start giving you options, you make wrong things. Only clavicular fracture. I'm discussing about clavicle, so only clavicular fracture is there. See, this is the medial end. Okay, if you can very clearly see, this is the medial 3/5 of the clavicle, right? This is the medial 3/5, and you can see this small part. This is called as a lateral 2/5. Okay, so you can see exactly the fracture point at the junction of medial 3/5 and lateral 2/5. So this is the most common site of the clavicular fracture. Very good, guys. Very good. Second important thing is that I told you that clavicle on one side it is attached to sternum, right? If clavicle is attaching to sternum, it must be forming a joint. So can I call this joint as sternoclavicular joint? In the same way, clavicle on the other end, I mean lateral end, it is attached to acromion process. So the joint there is called as, what is that joint? This is sternoclavicular joint. This is called as acromioclavicular joint, right? So if you look at the next picture, you will understand here, right? So in this picture, it is complete, it is in a complete detail over here, that you see, it is forming a joint here, right? So this joint which is formed here, this is called as sternoclavicular joint. Sternoclavicular joint. So guys, just ignore these lines, okay? Sternoclavicular joint. And the joint that is formed to the acromion process and the clavicle over here is called as acromioclavicular joint. Acromioclavicular joint. Acromioclavicular joint. So I hope you're clear till here. One is sternoclavicular joint, another one is called as acromioclavicular joint. Guys, I have already discussed about the discussion of joints, right? We have already discussed in the class about the joints. So there I have already told you, if you remember, that sternoclavicular joint, पिछले video जो है ना, that was regarding joints only. So I told you regard that sternoclavicular joint is what type of joint? It is a saddle joint, okay? Sternoclavicular joint is a saddle joint. Okay, in the same way, very good, Najmal. Acromioclavicular joint is what? It is a synovial joint, but plain synovial joint. Okay, very good. It is a plain synovial joint. So these are the two important questions you need to remember, guys. Okay, these are the two important things. Now, guys, there is one more important genetic condition. In this genetic condition, what will happen is that by birth itself, both the clavicles will be absent. Okay, so if both the clavicles are absent, I told you in class number 2. In the second class, I told you some definitions. If you remember, in the first class, I think I told you what is dystrophy, what is atrophy, what is aplasia, right? What is plasia? Plasia matlab development. Aplasia means no development. So there is no development of clavicles. So can I call it as aplastic clavicles or aplasia of the clavicles, right? So that condition, just look at the picture below. You can see that condition over here. That condition over here is called as cleidocranial dysostosis. Okay. So what is cleidocranial dysostosis? Both the clavicles by the birth, they are absent. Okay. So when both the clavicles are absent, you see this muscle over here, this is called as your pectoralis muscle. So this pectoralis muscle is pulling this shoulder like this. This pectoralis muscle is pulling the left shoulder like this. So both the shoulder tips attach. I mean, they meet each other in this picture, as you can see here, right? So this is the concept behind cleidocranial dysostosis. So this condition over here, which you can see, is cleidocranial dysostosis. Okay, this condition over here is called as cleidocranial dysostosis. Very good, guys, very good. Divi Jain, very good. Kiran Yadav, perfect, very good. So this condition, in this condition, what is the thing you see? You see aplastic or hypoplastic clavicles. Hypoplastic clavicles or aplastic clavicles are the things which you see here. Guys, this is the maximum things you need to know regarding the clavicles. And there is one more thing also called as ossification centers. Actually, I don't think ossification centers will be asked in the exams. Previously, they used to ask, okay? But if you want to remember, you can just remember it, that this clavicle is having two ossification centers. Primary ossification centers matlab the point from where the development of the bone starts, the growth of the bone starts, is called as ossification centers. There are two ossification centers, primary and secondary. Okay, so primary ossification center is located in the center of the bone. Center of the bone matlab yahan pe. See, here you have got the primary ossification center. Secondary ossification centers are located on the corners of the bone. It means here, these are the secondary ossification centers. So for clavicle it is simple, but if you go for scapula and remaining bones, it will be very difficult to remember. If you want to remember it, okay, or else no one is going to ask because there is no clinical correlation with it. Okay. Now after the clavicle, the next bone we shall be discussing is your scapula. This is scapula, right? Now if you look at the scapula, scapula is a triangular shaped bone, yes or no? Right? Now after that, two important things you can see, guys. If I'm putting the scapula in this way, you can see scapula like a dome, right? Anything above here, anything above and everything is below. See, anything below here is called as hypo or sub, right? So this is called as sub. So this part is called as supra or dorsal side. Okay. So this is the ventral side of the scapula. This is the dorsal side of the scapula. Now, if you look at the dorsal side of the scapula, right, you can see a spinous projection here. This is called as a spine of the scapula. What is this called? Spine of scapula. Okay. Above the spine, this area which you can see is called as supraspinous fossa. Okay. Below the spine, this area which you can see is called as infraspinous fossa. Why are you calling it as supraspinous fossa? Because it is above the spine, and you know what muscle is located here? Supraspinatus muscle. Why are you calling it as infraspinous fossa? Because it is located below the spine, and what muscle is located here? Obviously by the name itself, infraspinatus muscle. Okay. Now if you turn back, right, from the anterior side or the ventral side, this is called as subscapular, right? You see subscapular is somewhat like a shallow, right? So why are you calling it as subscapular? Because here there is a muscle called as subscapularis muscle. Okay, so we have discussed three important things: supraspinatus, infraspinatus and subscapularis. Supraspinous muscle, infraspinatus muscle and subscapular muscle. Okay. Now what is happening with this spine? So if you look here, this spine, this is the spine. This spine is continuing anteriorly as a projection, right? So as you can see, the spine is going like this and continuing anteriorly like a projection. That projection is called as acromion process. See this part which you can see here, this is called as your acromion process. Okay, this is called as your acromion process. Next important thing, you see this part over here which I'm holding right now, right? This part over here is called as coracoid process of the scapula. Okay, don't confuse coracoid with acromion. Most of the students, when I meet them, when I give them a scapula, they're gonna tell this is a coracoid, this is acromion, right? So they both are different. This is acromion and this is coracoid process. Okay, I'll write all of them down now. Okay, don't worry about that. Next important thing, I am telling you that, okay, let me put this scapula on myself. So this scapula is like this actually, right? If this scapula is like this, so this should be left scapula. Yes or no? If this is left scapula, then this border, whatever is there, it is looking to the midline. Yes or no? See, if I am putting like this is the border that is projected to the midline. So this is called as a medial border of scapula, right? If this is a medial, then this is called as a lateral border. Now you tell me, look at the medial border and look at the lateral border. Which is thick? Is the medial border thick or the lateral border thick? Yes. Mayank, definitely you can get. Very good, very good. Lateral border is thick. Lateral border is the thickest border, and that is the reason why lateral border is also called as the head of the scapula. Okay, that is why it is also called as head of the scapula. One last thing before I write down the things here, that if you closely look on the top of the scapula, you can see a notch where I'm putting my pencil over here, right? You can see a notch here, right? So this notch is located on the top, right? So can I call it as a suprascapular notch, right? So this notch here is called as suprascapular notch, and this pencil which is running through this suprascapular notch is called as suprascapular nerve. Okay, suprascapular nerve. Now whatever things I've just discussed, we shall just put it down over here. Okay, we shall write down these things here. Right. Now if you look at this, this is a scapula. So this is a dorsal view of the scapula and this is the ventral view of the scapula, right? So in the dorsal view, I told you two important things. So this part over here is called as the suprascapular fossa. suprascapular, or I can also call it as supraspinatus, supraspinous fossa, and this is called as the infraspinous fossa, infraspinous fossa, and here this is called as a subscapular fossa, subscapular fossa. Okay, this is called as subscapular fossa, right? And all of you know, just now I told you that this part over here is called as the spine of the scapula. This is called as what? Spine of the scapula. And spine of the scapula is continuing anteriorly as this process. What is this? Very good, very good, very good. This is called as acromion process. This is called as acromion process. Acromion process. Whereas this one over here is called as coracoid process of scapula. Remember one thing, there are two things. One is called coracoid process, another one is called as coronoid process. Okay, so I will tell you what is coronoid process. Okay, so coracoid process is different than this. Clear? Now, all of you just concentrate here, guys. I told you two borders. I told you. See, from here till here. See, this one over here is called as the medial border of the scapula, right? Whereas this part over here is called as the lateral border of scapula. Okay, lateral border of scapula. In the picture also, if you can see here clearly, right? You see lateral border of scapula is thick. Yes or no? Lateral border of scapula is thick. Medial border of scapula is very thin. So that is the reason why you call lateral border of scapula as the thickest border, right? Thickest, and also it is called as the head of the scapula. Thickest, and it is also called as the head of the scapula, head of the scapula, right? So till here you are clear, guys. So in clavicle we discussed one clinical point. What was that? Cleidocranial dysostosis, है ना? So यहाँ पे भी even in this scapula also we shall discuss one clinical point. And what is that clinical point? Okay, so if you look at the scapula, basically during 9 to 10 weeks of gestation, okay, during 9 to 10 weeks of gestation, what will happen is that the scapulas are usually formed in the cervical region. Okay, so from the cervical region the scapulas descend down to the shoulder. Okay, from the cervical region the scapulas descend down to the shoulder. For example, if there is any kind of cervical spine abnormality, क्या होगा? Out of two scapulas, one scapula will descend down normally, but another scapula will not descend down. So it will stay in the neck itself. So when it will stay in the neck, if you look at the picture, one scapula is down and one scapula is up like this. Yes or no? So all of you just look at this picture over here. In this picture, one scapula is down and one scapula is up. So very good. Very good. Suraj Kumar has already answered. He is telling that this is springal deformity. Very good, Najmal. Perfect. So this is called as springal deformity. Now in this springal deformity, if you see, this is a normal scapula which is located in a normal position, and this is a high end scapula. You can also call it as high end scapular deformity. Okay, high end scapular deformity. Clear? So this condition which you can see here is called as springal deformity. Right? So this condition which you can see here is called as springal deformity. So here, very clear important thing you need to know, is the problem with the scapula or is the problem with the cervical spine? It is a problem with the cervical spine. Okay, it is just because of cervical spine abnormality the scapula is not descending down. If cervical spine abnormality is not there, the scapula would have descended down, right? So springal deformity is because of cervical spine abnormality. Cervical spine abnormality. Cervical spine abnormality, right? Now, in the exams nowadays, they are also asking one more thing, that what is the other name for this? Other name for this is also called as congenital high scapula. Okay, so this is also called as congenital high scapula. Congenital high scapula. Okay, so this is also called as congenital high scapula. Obviously, it is congenital only. right? And the scapula is on the higher end, so it is called as congenital high scapula. Now, by looking at this picture, will you be able to answer this, yes or no? Is it difficult, guys, so far? So far, everything is easy, or you're finding anything difficult over here? Let me know. Yes? Very good, very good. Now, the next bone after clavicle and scapula we shall be discussing is this humerus. Okay. So, in this humerus, what are the important things which you can find in this humerus? First of all, humerus is the bone of your hand, right? That is wrong. It is a bone of your arm. What is hand? This is hand. Okay. Most of you think hand matlab ye pura hand. No. This is shoulder. This is arm. This is forearm, and this is hand. Okay. Chalo. This is the bone of your hand. Now, in this rounded part which you can see here, this is called as the head of the, what is this? Humerus. Head of the humerus. Okay. This is called head of the humerus. And this entire part which you can see here, this is called as the shaft of the humerus. Okay. Shaft of the humerus. Now, if you see both the ends are not equal. One end you have got head, and on the other end you have got condyles. What do you have? You have got condyles. If you look at the head of the scapula, there are two important things which you need to know, right? So if I'm holding humerus, right, not scapula, just I'm sorry. If I'm holding this humerus like this, right, exactly the way I'm holding this is called as the surgical neck of the humerus. What is this neck called as? Surgical neck of the humerus. And if you closely look, guys, I know it is not clear here, I'll show it to you in the picture. Okay? If you closely look here, you see this border surrounding the head, whatever you can see, right? This is called as the anatomical neck. Okay, so this part over here is called as anatomical neck. So how many necks do we have in the humerus? Two necks. One is called anatomical neck, one is called as the surgical neck. Sir, what is the importance? Importance यही है कि most common fractures happen to the surgical neck. Okay, most commonly the fractures happen to the surgical neck of the humerus. I'll show you X-ray and you will diagnose and tell me. Okay, so why the fractures will happen to the surgical neck? See, for example, if this is the humerus, okay, this is the humerus like this. What is happening? For example, if I'm falling on my outstretched hand, these injuries are called as Fuchs injuries. FOOSH. FOOSH matlab fall on outstretched hand. Okay? So when I'm falling on my outstretched hand like this, the entire impact is happening on this part over here. Right? This part matlab kya? What is this? Surgical neck. So surgical neck can easily fracture. Okay? Right. Apart from that, here you can see a bigger structure here and you can see a small structure over here. Now anything that has a big protrusion like thing, a bony protrusion, है ना? A bigger bony protrusion, a smaller bony protrusion. A bigger bony protrusion को बोलते हैं tubercle. This is called as tuberosity, right? And this one is called as greater tuberosity. And ये छोटा वाला जो है ना, this is called as lesser tuberosity. Okay, so how many tuberosities we have got? We have got greater tuberosity over here and we have got lesser tuberosity. Now, in between both the tuberosities, can you see a small groove like thing, right? Can you see a small groove? This groove is called as intertubercular sulcus. Intertubercle matlab between both the tubercles, right? And it is like a sulcus, so you call it as intertubercular sulcus. The other name for that is bicipital groove. What is the other name for that? Bicipital groove. Why am I stressing on these points very much is that you will come across 2 to 3 different muscles that are attached here and that are very much asked in the exams, and almost all the time they're asked in the exams. Right? So that is the important thing which you need to know. Very good, Anand. Gohar, very good. So if you come little bit down, over here, this is the condylar region. Now here I have got two condyles. One is called medial condyle, another one is called as lateral condyle. Okay. Now look at medial and lateral condyle, guys. Which is more protruded, medial or lateral? Actually, you should not use the word protruded. You should use which is more prominent, medial or lateral. Very good. Medial epicondyle is more protruded, okay, than the lateral one. So if I fall on an outstretched hand, guys, all the way, by the way, you can even palpate your medial epicondyle here. All of you can palpate here. This bony protrusion, whatever you can feel, is the medial epicondyle. So Now you tell me, out of this medial epicondyle and lateral epicondyle, things which are more protruded are more easily fracturable. Yes or no? So medial epicondyle fractures are more common in comparison with the lateral epicondyle fractures. Right? So here I told you two important things: surgical neck fracture, उसके बाद medial epicondyle neck fracture. Okay? अगर fracture यहाँ पे हुआ, this is shaft, so I can call it as mid shaft fracture of humerus. What is that fracture called? Mid shaft fracture of humerus. Okay? The last fracture I'm going to tell you, these are the two epicondyles, right? These are the two epicondyles. Exactly above this epicondyle, you see this place, right? So this place is located above the epicondyle. So this place, can I call it a supracondylar region because it is located above? So supracondylar region fractures are also more common in children. Okay. So why it is more common in children is that it would take around 20-21 years for this part to fuse. तो जब तक ये फ्यूज नहीं होगा तब तक ये वीकेस्ट पार्ट है. सो देर आर हाई चांसेस दैट देर कैन बी फ्रैक्चर्स हियर. So these fractures are called as supracondylar fractures. Okay. So 1, 2, 3 and 4. 4 fractures I told you in the humerus. Right. I'll show them to you and you are the one who gonna diagnose and tell me. ठीक है? चलो. Let us discuss all those 4 fractures over this image over here. Okay? Now in this image, what are the things you can see? I already told you this is called as the head of the humerus. This is called as the head. Okay. Now I told you there are two tubercles. One is called as greater tubercle, another one is called as lesser tubercle, right? So if you can see here, this is called as a greater tubercle, right? So this is called as the lesser tubercle. Okay. Or you can write it as greater tuberosity, another one is called as a lesser tuberosity. Greater tuberosity, another one is called as a lesser tuberosity. And let me draw with an yellow shade over here, guys. I am putting an yellow shade over here so that it would be clear for you. You can see this yellow part which I am highlighting right now, right? So this yellow part, whatever I am highlighting right now, right? So this yellow part which I am highlighting right now, this is what is called as bicipital groove. Okay, what is this called? This is called as your bicipital groove. Bicipital groove. Okay. Now, next important thing is that I told you there are two necks. What are the two necks? Anatomical and surgical. Ab ye dekho, where is anatomical and surgical? See here. So this dotted lines, whatever I am drawing here, this is called as anatomical neck. And this part, whatever I am drawing here, this is called as surgical neck of the humerus. Okay. So one is anatomical neck and the other one is called as your surgical neck. So this is called as anatomical neck. Okay. And this one over here is called as surgical neck. Surgical neck. Right. So any bony protrusion, you call it as a tubercle or a tuberosity. Okay, Ricky? Clear? And by the way, मैंने fractures का, what did I tell you? How do you write fracture? This is how you write a fracture. Okay, this is a symbol how you represent a fracture. Okay, right. So till here you are clear. Now what is the thing is that I will show you, and by the way, fractures I told you, right? So let me a little bit prolong this bone over here. So let me extend this bone. Right. Now this is called as medial epicondyle. This is called as medial epicondyle. Now if this is called as medial epicondyle, this should be called as lateral epicondyle. Lateral epicondyle. Sir, how are you telling this is medial, that is lateral? On what basis are you telling? On what basis I am telling is that, see, wherever the head is there, now this head is looking left, right? If I'm putting like this, the head is looking right. Now if I'm putting like this, the head is looking left. Wherever the head is there, that side is called as the medial side. It means, so this entire side is called as a medial side. So on the medial side only you have got this epicondyle, so medial epicondyle. Okay. Back of this head, whatever is there, this is called as a lateral side. So that is why you call this as a lateral epicondyle. You are clear with this, right? So one is called as medial and one is called as a lateral. So what are the fractures now? Fracture can happen at the surgical neck. So this is called as surgical neck fracture. Okay. Fracture can happen exactly in the mid shaft also. Okay. So this is called as mid shaft fracture of humerus. Mid shaft fracture of humerus. Fracture can happen to the medial epicondyle also. So you can call it as medial epicondyle fracture. Okay. Now I will show you the X-ray. You will tell me the diagnosis. So this is a, let us say, I will give you a case, okay, how the cases are in the next exam. Let us say a 19-year-old boy, okay, let us say 21-year-old boy. So he is he's participating in a bicycle race, okay. So what happened is that whatever it is, because of some damaged road or because of the sand or whatever it is, his bicycle slipped and he fell down on an outstretched hand. Outstretched hand matlab like this, okay. So when he fell down on an outstretched hand, once he got up, he is not able to move his upper arm. He is not able to lift his upper arm. So he is catching hold of his left arm with the help of right arm like this, okay. And he came to the clinic. Now what will I do? Will I tell the patient to do exercises? No. He is in severe pain, right? So first important thing I do is, first of all, I give some NSH to the patients, some pain relief, some painkillers to the patients. Maybe I can give morphine also, right? So I'll give morphine, or let us say paracetamol, ibuprofen, acetaminophen, whatever it is, I am giving some painkillers. After giving painkillers, I will send the patient to an X-ray room. In the X-ray room, they will take an X-ray, AP view, anteroposterior view, and PA view, posterior anterior view. There are two views, you know, right? PA view, AP view, right? Whatever it is. After that, I got this X-ray over here. Now you diagnose and tell me, what fracture is this? Exactly tell me. How do you write down a fracture? Don't just tell me the name of the fracture. You should also tell me which side, right or left. Yeah? You cannot just write it as right left, guys. You have to exactly tell that this is right surgical neck fracture. Okay. What do you have to write it as? You have to write it as right surgical neck fracture. Right surgical neck fracture. Okay. Right surgical neck fracture. Very good. Actually, guys, every fracture involves a damage to a specific nerve or an artery. Okay. This surgical neck fracture, right here, there is a nerve called as an axillary nerve. So right now, you are the guys who are entering into MBBS first year. So I don't want to put a lot of pressure explaining what is the nerve damage, right? Because of that, what kind of hand, what kind of deformity you see, all these things we'll discuss in later on sessions. Okay. So for now, just need to know regarding the fractures. Very good, guys. So this is right surgical neck fracture, right? Now all of you diagnose and tell me, what is this fracture here? Please say left or right. Ahmed definitely will send it. Join in the Telegram group so that you will get the notes over there. Okay. Please say, don't tell it just left. Left or very good. Left sided mid shaft fracture on the left. Very good. Left sided mid shaft fracture. Okay. So you can see left mid shaft fracture of what? Fracture of humerus. Left mid shaft fracture of humerus. Left mid shaft fracture of humerus. Okay. So this is called as left mid shaft fracture of humerus. Very good. Guys, you know what is this? These are called as intramedullary nailings and platings. Okay. So these are the plates and nails which we put. Okay. So there are basically two different types of surgeries. One is called as intramedullary nailing. Another one is called as plating. Okay. So plating in the sense you open the fracture site. Okay. For example, I got a fracture here. You are cutting open the fracture site. You put a plate and attach the screws there. So that is called as plating. Intramedullary nailing is another thing where you give a small incisions and put a guide wire inside and then drop the nails over there. So that is called as intramedullary nailing. Sir, should I know this in my first year? Absolutely no. You need not to know this. This you see in case of orthopedics and all. But I just wanted to tell you, अगर mid shaft fracture हुआ, देखो यहाँ पे mid shaft fracture हुआ. Can you see the mid shaft fracture here? Right? Can you see the mid shaft fracture clearly? So if there is a mid shaft fracture, this is how the nailings they usually do. Okay? Right. Now after that, next important thing. Tell me what fracture is this? Look very clearly and tell me what fracture is this. Is this a surgical neck fracture or a mid shaft fracture? Batao. Is this a surgical neck fracture or a mid shaft fracture? Or is it a normal X-ray? Patan is telling normal. Anyone? Very good. Very good. Very good. So this is a medial condylar fracture. Medial epicondyle fracture. Someone told lateral epicondyle. No, it is not lateral epicondyle, guys. You can very clearly see. You see this? This is a radius over here. Okay. This is a radius and the other side is your ulna. So this protrusion, whatever you can see here, right? So that has been broken off. Okay. You can see there is a fracture. This is the medial epicondyle. Very good, guys. So this is a medial epicondylar fracture. Okay. This is a medial epicondylar fracture. Medial epicondylar fracture. Very good. Now, tell me which fracture is this? I told you out of medial epicondyle and lateral epicondyle, which are the fracture that is more commonly happening? Medial epicondyle. क्यों? क्योंकि medial epicondyle over here is more prominent or protruded. That is the reason why medial epicondyle fractures are more common, right? Very good. Kaha lateral? Not lateral. This is also medial only. Okay, this is also medial epicondylar fracture. Medial epicondylar fracture. This is also medial epicondylar fracture. Very good. So guys, all of you understood all the fractures which I'm telling over here. All of you are understanding, right? Very good. Now there is one more thing. What is another thing? What is another thing is that all of you know this picture, that let us say this is your radius. Okay, this is your ulna. Okay, this is your radius and ulna. If you look here, guys, ulna bone is perfectly straight. Ulna bone is perfectly straight. But if you look at the radius is twisting all the way like this. You see? If you see two bones, this is radius, this is by the name radius, and this is by the name ulna. Radius as well as ulna, right? If you see, ulna bone is perfectly straight, but the radius bone is twisted. It is not twisted actually. A radius bone is bowing forward, hai? There is bending forward. So this condition you call it as anterior bowing of radius. Okay, this you call it as anterior bowing of radius bone. Okay, what is this called? This is called as anterior bowing of radius. Anterior bowing of radius is also, and basically this deformity you see in an age group of between 4 to 10 years. 4 to 10 years, and this condition is also given another name that is called as maid lung deformity. What is that deformity? Maid lung deformity. Maid lung deformity. Okay, so you see a maid lung deformity over here, you can see it clearly, and if you want, I'll prove it. You see here, the ulna bone is perfectly straight, right? Only the bent part, which is the bone that is bending, radius. Here also you see the ulna bone is perfectly straight, and the bone which is bending down here is radius bone. Okay, so all of you are clear, guys? All of you are clear? If you look at the real hand also, here exactly you cannot see, guys, because there are all the muscles and tissues overlapping here. You cannot see the clear, you cannot look at the clear picture, but I can figure out that this is our radius bone which is taking a turn, and this is our ulna. Okay, you cannot figure out, but anyways, don't worry, there no one is going to ask you this picture. Max to max they're going to give you this picture only. Okay, so this is all you need to know regarding this. Sir, ho gaya fractures? No, there are much more fractures. There are fractures like Gailiesi fracture, Montague fracture and all. Those will study deep in orthopedics, but I just wanted to tell you how to name a fracture. Okay, so that was my intention, as this is just an introductory class, right? So this will be more than enough for you. But the most important part in the upper limb regarding the osteology is the carpal bones, guys. Very, very important. Just look at the pictures, whatever I'm drawing. Okay, so all of you look here. In the carpal bones, this bone over here is called as your radius bone. This bone over here is called as your radius bone. Okay, and after that, this bone over here is called as your ulna bone. So one is called as your radius bone and the other one is called as your ulna bone. Clear? Now, below this radius and ulna, I told you we have got how many carpals do we have, guys? We have got 8 different carpals, right? So 4 and 4, completely 8 carpals we have. And by the way, tell me the joint that is located in between these carpals, this joint is responsible for little bit forward and backward gliding. So I can also call it as minimally gliding joints or sliding joints, right? So beneath this, we have got 8 carpal bones. So this is 1, 2, 3 and 4, 5, 6, 7 as well as 8. Okay. How do I remember these 8 carpal bones? An easy way to remember these 8 carpal bones are, remember it like this. So she likes to play. She likes to play. Try to catch her. Try to catch her. Actually, there are some thousand different types of mnemonic you will be hearing, guys. But whatever it is, find the best part. So this is what I felt best from my MBBS first year. So this is why I'm using and I'm surviving on this. Even you also survive on any formula, whatever it is. Okay? So what does S stands for? So let us put those things over here. See, she likes to play. She likes to play. Try to catch her. Try to catch her. Right? Now, if I'm dividing this carpal bones into two, see the upper, there are 2 rows. The top row is facing towards the radius and ulna, and the lower row, whatever is there, this will face the metacarpals, because these are carpals. Iske baad kya hoga? Metacarpals. So these carpals are facing the metacarpals. So these carpals which you can see, SLTP, these are towards the radius and ulna. Towards the radius and ulna matlab towards your body. Anything towards your body is called proximal. Anything away from your body is called as distal. I hope you understood, right? If I am taking humerus itself, if I am taking this humerus itself, now in this humerus also, the head is towards my body, whereas the medial lateral epicondyle is away from the body. So this head is proximal and this part is distal. You're clear with that? Right. So I can tell that these group of bones are proximal, right? These are distal. So in the proximal, what do we have? She likes to play. S stands for scaphoid. S stands for scaphoid, right? L stands for lunate. L stands for lunate. T stands for triquetrum. T stands for triquetrum. P stands for pisiform. Okay. Actually, pisiform is a smallest carpal bone and it is sesamoid bone. Okay. As you have patella. Patella is a sesamoid bone. You studied it, hai na? Pisiform bhi sesamoid bone hai. Right. Now coming to T. T stands for trapezium. Trapezium. Next, T stands for trapezoid. Trapezoid, right? And next, C stands for capitate. C stands for capitate. H stands for hamate. H stands for hamate. So these are the 8 carpal bones which you have. Okay? और एक बार revise करेंगे. So what are the 8 carpal bones? She likes to play. Try to catch her. S stands for scaphoid. L stands for lunate. Okay, lunate. Moon shaped bone is called lunate. Okay, next T stands for triquetrum. P stands for pisiform. हो गया. Next, try to catch her. T stands for trapezium. T stands for trapezoid. Okay, another one is standing for capitate, and next is hamate. Okay, you know, most of the students, where do they confuse? They confuse here. They confuse before these three, T, T and T. They don't know where to put these T's. Okay, so you just have to practice them. If I also develop a mnemonic here, everything will be a mnemonic. So to remember a mnemonic also, I should develop another mnemonic. Okay, that will be a hell. Okay, ऐसे ही याद रखो. Clear? Now just beneath this we have got our metacarpals. So we have got our 1, 2, 3, 4 as well as 5. Okay, so we have got 5 metacarpals over here. 5 metacarpals over here. Clear, all of you? After this 5 metacarpals, what do we have? We have got phalanges. What are the phalanges? Here देखो, these are the 2 phalanges, right? Here we have got 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, right? So all of you can see that thumb has got only 2 phalanges. Now you guys will tell me, for my index finger, there are 3 phalanges, 1, 2 and 3. 3 phalanges are there. Now which is proximal, which is distal? Tell this thing, which is proximal and which is distal? Yes? Out of these 3 phalanges, which is proximal and which is distal? Okay, I'm pointing my finger at this phalange. Okay, now tell me, this phalange is proximal or distal? This phalange is proximal or distal? This one is proximal or distal? Very good, very good, very good, very good, Lipika. So this phalange, right, this phalange which you can see here, ये वाला, this phalange is towards my body, so this will be proximal, and this part of the phalange is away from my body, so this will be distal. तो ये क्या होगा? It is staying in middle, so it is called as a middle phalange. So one is called as a proximal phalange, distal phalange and middle phalange. But if you look at the thumb has got only 2 phalanges. What are they? This phalange is towards the body, so proximal, and this phalange is away from the body, so distal. This is the only thing you have to remember. Okay? Clear, all of you? Right. Guys, previously, okay, in previous centuries and all, let us think it as centuries, right? What used to happen is that they used to give one word questions a lot, whether it might be a NEET PG or whether it might be an FMGE. One word answers, right? Even if your parents are doctors, so when they have written their exams, ask them that there are many fact based questions which they used to give, right? So actually there is no need of discussing those fact based questions, but just to tell you how the fact based questions were, I'll discuss right now. Okay, so first fact based question regarding these are, first important thing, they asked most common fractured bone in the most common fractured carpal bone. Most common fractured carpal bone. Anyone? Most common fractured carpal bone, right? So this question is also not only for the students, for also for your parents as well. Okay? Let us see. If any one of your parent is a doctor, let us see, will they answer it or not? Will they remember that their first day of their anatomy class or not? Okay? Very good, very good, very good, very good. Scaphoid. Right, guys, you should comment down whether your parents are answering this or no. Right. Second important thing, most common dislocated carpal bone. Most common your parents are also answering. Most common dislocated carpal bone. Dislocated carpal bone. Very good. Very, very, very good. Most common dislocated carpal bone is your lunate. Very good. That is your lunate. That is your lunate bone. Lunate is the, guys, just sorry about these lines. This is just an error. Whatever I can see here. Let me correct it. Chalo, whatever it is, guys. Give me a second. So lunate is the most commonly dislocated carpal bone. Right, now after this, what is the largest carpal bone? What is the largest carpal bone, guys? What is the largest carpal bone? Yes, the largest carpal bone. Very good. The largest carpal bone is capitate. Okay, capitate is the largest carpal bone. Now after this, the shortest carpal bone, right? What is the shortest? Or instead of shortest, let me write it as what is the shortest metacarpal? Shortest metacarpal. Shortest metacarpal. I asked shortest metacarpal. Very good. Fun mode. Very good. The first metacarpal is the shortest metacarpal. First metacarpal is the shortest metacarpal. Okay. Right. So guys, one very important question you need to remember, that the most common carpal bone which is more prone to undergo avascular necrosis is your scaphoid. Okay. So this would undergo avascular necrosis. Avascular necrosis. Okay. Guys, still here all of you are understanding, you guys are just watching the lecture or you are also writing the notes? You're almost done. You're almost done. We are about to close in 5-4 minutes. Wow, you are writing both. Very good. Now, why is this surprise that all of a sudden yesterday there were only 30 and today there are 73 touching 90 and all? Yeah. Yesterday you were busy. Right. Chalo, whatever it is. Sir, any clinical points here? Yes, there are. I am coming very soon. I'll be coming very soon there to take classes for you. My name is Krishna. My name is Krishna. Right. Chalo. If you look at the hand, right, there are two important fractures which you need to know. For example, when I'm punching someone like this, right? So during when you're boxing, right, when you're punching your opponent, when you're punching, you don't punch like this, right? You don't punch like this. So you punch in this way. So when you're punching here, see this part, ye part kaun sa hai? Lateral part. This lateral part is in contact, right? Most of the pressure, right, this pressure, the punch pressure is impended on to this lateral part. So what will happen? The last metacarpal, which is also called fifth metacarpal, there are chances that this can fracture. Yes or no? So if this fifth metacarpal is going to fracture, that too because of boxing, can I call this fracture as boxer's fracture? Yes or no? I can call this as boxer's fracture, right? So all of you just look at the boxer's fracture over here. Can you clearly look at a fracture over here, guys? Yes or no? Fifth metacarpal fracture, boxer's fracture, right? Now you will tell me this fracture happened to the proximal end or a distal end? बताओ ये fracture कहाँ पे हुआ? Proximal or distal end? I'm writing it as boxer fracture. Okay, is it happening proximal to the proximal end or to the distal end? Hello Suraj, how are you? Very good. See, if this is kaha proximal. What did I tell you? Anything which is away from the body is called distal. Anything towards the body is called as proximal. Fracture is happening at the distal. Very good, Ashish. Ashish, very good. ये देखो, fracture is happening at the distal end. So exactly opposite of this. Exactly opposite मतलब यहाँ पे fracture distal end पे हुआ, right? And the fracture has happened to the fifth metacarpal. Now I am telling fracture is happening to the opposite of fifth is first metacarpal, right? Now here the fracture happened to the distal side. Now I am telling fracture is happening to the proximal side. So just look at the fracture here. ये देखो ऑपोजिट ऑफ फिफ्थ फिंगर इज फर्स्ट फिंगर, ये देखो फर्स्ट फिंगर है. ऑपोजिट ऑफ डिस्टल इज प्रॉक्सिमल. यू सी अ फ्रैक्चर ओवर हियर टू द प्रॉक्सिमल एंड, राइट. This fracture is called as Bennett fracture. This fracture is called as Bennett fracture. So there are two important fractures which you need to know. If there is a fracture to the base of first metacarpal, clearly telling again, base of first metacarpal पे fracture हुआ, that is called as Bennett fracture. If there is a fracture to the distal end of the fifth metacarpal, that is called as Boxer's fracture. All of you understood whatever I've told you now? Yes or no? Be jaldi. Guys, right. This is all for today. And again, if you are packing your luggages back to go back there, and again I'm telling you one thing, don't take color pencils with you, okay? When I'm teaching you, when I'm telling you, you have to learn everything by drawing and all. ड्राइंग मतलब एक पेंसिल से भी ड्राइंग हो सकता है. यू नीड नॉट टू कलर इट, है ना. टॉपिक का नाम रेड से अंडरलाइन इट विथ ब्लैक, स्केच इट, दो फ्लावर्स लगा वहां या नो. Don't do these things, that would take a lot of time, okay. Or just use only four colors: red, green, blue and black. That's it. Four colors are important points you just underline with red. ठीक है. इससे ज्यादा no fifth color at all. Don't waste your time making the notes beautiful, okay. If you want to waste time, waste the time making the notes, but don't waste the time making the notes beautiful, okay. That is not going to be useful for you, है ना. So this is one more important thing which you have to know. Okay. So again I'm telling you, don't work hard, okay. Hard work is a bad word. Work with passion. Every day, wake up every day with a passion, right. When you're studying any topic, when I used to study the topics, I even literally used to not feel sleepy because I used to be so deep into the concept that what used to happen in the treatment, what is the next prognosis. So these are the things used to continuously they run in my mind. So that is how it should happen to you also, okay. You have to go too deep into the subject, study every day with passion. If you are studying it hardly, 5 years you have to study it hardly, right. So you will just remember, you will just forget everything, okay. So this is all I want you to know. Chalo guys, so thank you so much, right. And by the time when you go there, है ना, schedule banega, my schedule also will come. So as per the schedule, I'll be visiting each and every university for around 10-15 days and I'll be finishing up the subjects, and that's it. Okay. So all of you guys, goodbye and take care, and love you all.